So what's so special and what's so different about Irvine Spine and Wellness Center and other chiropractic and wellness clinics? Let me tell you a little something about Irvine Spine and Wellness Center. I've been in practice over 2 decades, and I am committed to finding out the right answer to chronic musculoskeletal issues. I have become specialized in postural neurology, the neurology behind posture, and functional movement, the biological patterns of movement. The two of them together are the reason why all of us as infants started developing, and through developing neural tracks, the connection, the roadway between the brain and body parts, and functional movement, the proper movement patterns, we all are now moving. Most issues behind chronic musculoskeletal issues, neck pain, back pain, headaches, sciatica, knee pain, shoulder pain, foot pain, these are all more than likely as a result of our lifestyle and or injuries we've had in the past. You see, obviously no one dies from those issues. What ends up happening is their patterns of movement change. The brain, therefore, rewires, so to speak, how things are happening when it comes to movement. If movement is a concert, your brain is a conductor and your body parts are the musicians. While one single part may have the spotlight on it because that specific movement requires more effort on that part of the body, the rest of the body has to support the structure with pathological patterns of movement, the chiming in of those other body parts, and the role of the injured body part changes, therefore causes pathology. So at Irvine Spine and Wellness Center, we provide what is needed to reshift this whole pathological pattern of movement back to biological pattern of movement. This is not done in words. This is not done by adjusting the spine and thinking that's it. This is not done by giving a patient bands and weights and kettlebell and isolating the part and expect for the magic to happen. This is done by implementing postural neurology, the impact of that posture, the wrong posture on the brain, by exercising the brain through what's called positive neuroplasticity. Just like your body part you exercise your brain to redo the map, to bring it back to the initial designed map for movement and posture. This is called homunculus. By the way, these exercises are not giving a weight or having you do puzzles or anything like that. Those are exercises with regards to the part of the brain that has to do with neurology of the posture. So after that, and in conjunction with those exercises, we start doing exercises that we all did as babies. So these are developmental exercises that we all do. For instance, if your shoulder blade, you've got issues in between your shoulder blades, we don't put you on an exercise ball and have you do Superman exercises. What you end up doing is pushing yourself up, which is what you did at age 3 months. It's more complicated. It's really hard to put it in this video. So I suggest that you check out my YouTube channel, which has a lot of videos that will show you more what developmental kinesiology or postural neurology are. I hope this helps you so you can make a decision as to what is the best route to put an end to your chronic musculoskeletal issues and to your injuries that are limiting you from doing the very things you love to do in life. It's all in your own hands, and it's all making the right decision. Thank you for watching. Take care.